Hello everyone, I am Pranay Gupta, presenting my PPT for CW's evaluation of applied physics. As the worldwide age population has grown in recent years, the medical sector has been confronted with a new challenge: how to assist the patients in achieving real time health monitoring. This is done through innovations in wearable biosensors for healthcare, which is the topic for this presentation. In this presentation, we will cover the introduction of what is a biosensor. We will talk about sensor designs, transducers used, what are the real world examples in which these are being used, what lies ahead in the form of challenges and directions, and finally, we will have a summary. Introduction to wearable biosensors. Biosensors are analytical devices that integrate biological sensing elements with transducers to detect and quantify specific biological analytes. These includes the major components include biological recognition element. This component interacts selectively with the target analyte. It can be an enzyme, antibody, DNA or RNA sequence, cell receptor, or a whole cell. Second is transducer. This converts the biochemical signal produced by the interaction of the biological recognition element with the analyte into a quantifiable signal. Common transducers include electrochemical, optical, piezoelectric, and thermal transducers, which we will be talking about. And finally, there is the signal processing system. This processes the signal from the transducer into a readable output. It involves electronics, software, and display systems. Overall, biosensors drive a paradigm shift in healthcare delivery by enabling early detection, continuous monitoring, and personalized interventions, ultimately leading to improved patient outcomes and healthcare efficiency. These are the different sensor designs that we have in place right now. It is saliva based sensors, tear based sensors, sweat based sensors, breath based sensors, implantable sensors, and ISF blood based sensors. Next, we will talk about different sensor designs that are the most used ones. First is a sweat biosensor. As the skin covers most of our body, skin-borne devices are the most important wearable biosensors. In general, sweat contains various metabolites such as lactate and urea and minerals, and these biosensors perform a large amount of original humoral analysis for non-invasive monitoring of physiological health status and disease diagnosis management. Second, we have a tear-based variable sensor. Tear fluid is also used to assess physiological health and biomarker molecules present in tear fluid diffuse directly from the blood, indicating a positive correlation with blood pressure marker concentrations. Tear fluid is a component of the eye's anti-fouling mechanism, and its composition is significantly less complex than blood's, making it a great candidate for non-invasive monitoring and diagnosis. Third, we have saliva-based variable sensors. Saliva has been more popular as a diagnostic fluid in recent years, as the number of oral disorders have increased. Many biomarkers in saliva enter saliva by directly cell to cell transfer in the human body, allowing saliva to represent the physiological condition of the human body and serving as as an ideal non invasive sampling method to replace blood analysis. Implantable and subcutaneous biosensors. Advancements in the field of developing devices for subcutaneous wearable monitoring of intracellular fluids have gained significant attention in recent years. Usually, these surround the cells beneath the epidermal layer and help in the regulation of optimal organ homeostasis. Basically, I believe the most important outcome of these biosensors is that we have to avoid taking blood from the body, which is painful, and sweat, tear, and saliva are good options that we can use to avoid. Sensor design development. So this chart, which I have taken from the second reference, this tells us how the sensor design has developed through the years. Biosensors gained popularity during the 1980s, reflecting the growing emphasis on biotech. New biosensor transduction principles were introduced during this decade, including the fiber optic and mass sensitive piezoelectric devices. Considerable efforts during the 1980s led to the introduction of commercial self-testing blood glucose strips that used mediator-based enzyme electrodes. Subsequently, activity during the 1990s resulted in subcutaneously implantable needle-type electrodes for real-time glucose monitoring. The emergence of nanotechnology in the late 1990s has led to a variety of nanomaterial-based biosensors, exploiting the attractive properties of different nanomaterials such as silicon nanowires and gold nanoparticles for label-free or amplified biosensing. Next, we see what are the transducers used in these different biosensors. First is the electrochemical biosensor. Electrochemical biosensors measure changes in electrical properties such as current, voltage, impedance resulting from biochemical reactions at the sensor surface. They typically consist of a working electrode, a reference electrode, and sometimes a counter electrode. The biological recognition element immobilized on the working electrode interact with the target analyte, leading to a measurable electrochemical signal. Examples include glucose biosensors based on the enzymatic conversion of glucose by glucose oxidase, DNA biosensors utilizing hybridization events between DNA strands. Second, we have optical biosensors. These sensors detect changes in light properties such as absorbance, fluorescence, refractive index caused by biomolecular interactions. Basically, they include a light source, optical elements such as lenses and filtering, and a detector. The biological recognition element interacts with the analyte, leading to changes in optical signals which are then measured. Examples include fluorescence based immunoassays, surface plasmon resonance, and optical fiber based biosensors. Next, we have biochemical biosensors. These utilize biochemical reactions or changes in biochemical properties to detect analytes. They can be based on enzymes, antibodies, nucleic acids, or whole cells as the biological recognition element. The interaction between the recognition element and the analyte again leads to a measurable signal. Example includes enzyme-based biosensors, immunoassays, and nucleic acid sensors. Piezoelectric sensors. Piezoelectric biosensors measure change in mass or viscoelastic properties of a surface due to biomolecular interactions. They typically consist of a piezoelectric crystal, such as quartz, whose resonance frequency changes upon binding of the analyte to the surface. Examples include quartz crystal microbalance sensors, which are widely used for label-free detection of biomolecules. Lastly, we have thermal biosensors, which detect changes in temperature resulting from biochemical reactions or binding events. They include a temperature sensor and a heater element. Interaction between the analyte and the recognition element leads to changes in the thermal properties that are then measured. Examples include isothermal titration calorimetry sensors, which measure heat released or absorbed during biochemical reactions, as told. Next, we talk about the real world examples. These include wearable ECG monitors for arrhythmia detection. Devices like the Apple Watch 4 series and newer models feature built in electrocardiogram ECG sensors capable of detecting irregular heart rhythms such as atrial fibrillation, AFib. It's called shortly for AFib. Continuous glucose monitoring systems for diabetes management, and we have wearable activity trackers for lifestyle management like the Fitbits that we wear often. Next, we go to the challenges that are associated with the large amount of data, mostly in the signal processing unit. First is data overload. Variable biosensors produce a continuous stream of data, and managing this data can be overwhelming, requiring robust data management and analytics solution. Data quality and reliability. Ensuring the accuracy and reliability of data generated by wearable biosensors is crucial for making informed clinical decisions. Also, with time, sensors quality of the data reduces, and a regular timely check is needed. Interpretation complexity. Interpreting variable biosensor data requires expertise in data analysis, signal processing, and clinical interpretation for which healthcare professionals might require additional training. Privacy and security. Biosensors collect sensitive health information, raising concerns about patient privacy. Safeguarding patient data against unauthorized access is paramount to maintain patient trust and compliance. Integration with electronic health record. Seamless data exchange and integration are essential for enabling comprehensive patient monitoring and incorporating variable data into clinical decision making. Regulatory compliance. Compliance with regulatory guidelines ensures the reliability and validity of wearable biosensor data for clinical use. Future directions. So, where is the industry going to? First is miniaturization and integration. Wearable biosensors will likely continue to become smaller, more lightweight, and seamlessly integrated into everyday clothing and accessories, enhancing user comfort and convenience. One example is the ring, uh, biosensors coming in the form of a ring, which is more user friendly, furthering my point. Second is advanced data analytics. Innovations in data analytics, including artificial intelligence and machine learning, will enable wearable biosensors to analyze large volumes of data, extract actionable insights, and predict health problems. Interoperability with healthcare systems. Efforts to improve interoperability with integration with electronic health records and healthcare systems will facilitate seamless data exchange and enable more effective solutions that can be discussed with the patients. Multimodal sensors. Future wearable devices may incorporate multiple sensors to capture a broader range of physiological parameters, enabling more comprehensive health monitoring and personalized insights. Finally, we have the summary. Wearable biosensors have the transformative potential to revolutionize patient care and healthcare delivery by enabling continuous monitoring, early detection of health issues, and personalized interventions. These devices offer unprecedented insights into individual health parameters, empowering patients to take proactive control of their health and enabling healthcare providers to deliver more personalized and timely care. Despite challenges such as data privacy, accuracy, and regulatory compliance, ongoing advancements in wearable biosensor technology and concerted efforts to address these challenges hold promise for realizing the full potential of wearable biosensors in improving patient outcomes and transforming healthcare delivery. Thank you. And these are the references that I've used in making these slides. Hope you liked the presentation. Thank you for watching.